here. Cardinal Health CEO Jason Hollar joins us live. Sir, thank you for being here in a Fox Business exclusive. You distribute drugs to, 90% of U.S. hospitals, 29,000 pharmacies worldwide. That's a lot of patients who depend on you. How closely are you watching this battle over the extension of the Obamacare subsidies?
Yeah, of course, it's something that we look at every single day, as well as the broader policy potential changes that are out there. And I think at the highest levels, what's important is that we are very supportive of the government and the administration's efforts to continue to have access to affordable health care while not sacrificing innovation. And so we're going to work with our customers and ultimately patients to do what we can with that. I think what's important from a healthcare and specifically a pharmaceutical industry perspective is just to step back and understand a little bit of the data. When you look at the ACA and who receives subsidies, it's roughly about 20 million, a little more than 20 million Americans have some form of subsidy. When you look at the CBO and other independent parties that look at those that could lose that insurance coverage, I've seen all sorts of numbers, but they typically are around potentially 20% of that 20 million. So you get to 4 million Americans that could lose coverage. Now, I'm not trying to minimize the impact on each and every one of those 4 million people, but that is a relatively small part, a percentage of the overall healthcare industry. That's a little over 1% of the number of Americans that have coverage. So for the industry, it's important for us to make sure access and affordability continues to be maintained, but we don't see it being a material significant impact on the pharmaceutical industry, especially considering that these are Americans under the age of 65, so they're most likely using less pharmaceutical products than those that are older and on Medicare.
Well, from a business standpoint, you just reported blowout quarterly results. You made something like $59 billion from the pharmaceutical and specialty solutions segment. That's up 23% year over year. To what do you attribute that?
Yeah, it falls into two key primary categories. Yes, utilization is very strong across the board, whether we're talking about lower cost generic products or the more specialized higher value products. We saw volume growth across the board, across all different types of classes of trade. So all of our customers, pharmacies, retail pharmacies, hospital systems, community physicians, we had a broad base of strength there. But what the Cardinal Health team did very, very well is we operated very effectively. We've been very focused on investing into the core of our operations, not only to be able to deliver that very significant 22% revenue growth, but also to do so in a way that is accretive to underlying earnings. And that's what helped get us to that 36% increase in our earnings per share. The pharma segment, as you highlighted, is by far the biggest, most significant part of our business and a key driver. Their earnings grew by 26%, but let's not miss the other 4 operating segments of our business that saw also very significant operating earnings growth. And when I step back and think about the strength we saw this quarter, what I'm most excited about is that all 5 of our operating segments had very significant double-digit earnings growth. So that's a great testament to the breadth and the strength of our business.
Well, there is one issue. President Trump has been very, very focused on bringing down the cost of drugs for Americans. He's even putting up this Trump RX website. They're putting that together. And I'm just wondering how that's going to affect your bottom line. Do you expect to kind of weave your way into it? Tell me how you view that.
Sure. No, we don't see it as in conflict with the broader industry and how we operate today. It's very much in coordination with it. I think it's important to step back. And one other data point about the pharmaceutical industry in the United States I think is very relevant is the 90-10 rule. 90% of the volume is in generics, which represents only 10% of the overall cost to the healthcare system, the pharmaceutical costs, which means the other half of that, or the other 90% of the cost, is in the 10% of the branded products. So the generics part of our business, which is none of the DTC type of models you're talking about, are largely unaffected by that. And that's important to patients. That's very low cost. Back to that access and affordability I mentioned at the start of this discussion remains outside of that. The DTC models are largely cash payers. It's not covering most all the commercial or government payers. And it's something that a lot of those models then link into the local pharmacy. So you can still use the Trump RX and go straight to your local pharmacy for that fulfillment. And we still see the traditional distribution wholesaler in the middle of many of those transactions, most all of those transactions, and we would expect that to continue.
Listen, we're a capitalist show. We're pro-business. We love when companies do well. But can you look our viewers in the eye right now and explain to them if they are going to be paying less for drugs in the future. I mean, Americans are just paying too much compared to other countries.
Well, that's way beyond what I have control for. For the branded products that we're talking about, that's 90% of the cost. We don't set the prices. Right. We are a fee-for-service organization. What's important to us is access and affordability. If you think about the more access and affordability that Americans have, the more volume to serve and solve their medical needs there is. And that's good for our business because we are paid, per the service of each and every one of those drugs. So we are very much aligned with the administration, very much aligned with the American people on greater access to affordable health care. And that means that we're all pulling in the same direction, and our organization, our industry is very well aligned with the intent of the government and what the actions are that we're participating in.
Well, your investors are happy. Stock is up more than 15% right now. Big earnings numbers here. Thank you for joining us. We'll continue to follow the story right alongside you guys at Cardinal.
Yeah, my pleasure. Thank you for having me.